The subject of today's video is what is a Medicare supplement and what does a Medicare supplement do? My name is Duncan and I'm the owner and founder of Trusted Benefits Direct. We specialize in helping those new to Medicare and already on Medicare make sense of Medicare so they can make the best decision for their needs on the right Medicare supplement and Part D prescription plan, or whether Medicare Advantage is best for them. We are an independent agency that represents almost every company in the market, and we help people in all 50 states along with the District of Columbia. By representing multiple companies, we are able to objectively compare all of the benefits from the plans and costs to make sure you are getting the exact right program at the best cost for your needs. And all of our services are free to you. And Medicare dictates the costs and benefits must be the exact same whether you use our free service or you go directly to the insurance company. Give us a call and we can help you get the exact right product for your needs at the best price. Okay, here we go. First, what is a Medicare supplement? I get this right from Medicare's publication titled Choosing a Medigap Policy, A Guide to Health Insurance for People with Medicare. It states on page 9, a Medigap policy is an insurance policy that helps supplement original Medicare and is sold by private companies. A Medigap policy can help pay some of the remaining healthcare costs that original Medicare doesn't pay for. Examples are covered services and supplies like copayments, coinsurance, and deductibles. Original Medicare pays for much, but not all, of the cost for covered healthcare services and supplies. These are gaps in Medicare coverage. It goes on to state, all Medigap policies must follow federal and state laws designed to protect you, and policies must be clearly identified as Medicare supplement insurance. Each standardized Medigap policy must offer the same basic benefits, no matter which insurance company sells it. Now this next sentence is very important, and it says, cost is usually the only difference between Medigap policies sold with the same letter, sold by different insurance companies. What this means is that all companies offering a Medicare supplement must have the same basic benefits. For example, if you are looking at a Plan G, you know the Plan G with every company is going to pay the same exact amount. If you have a Part A deductible claim and you have a Plan G, you know that every company will pay the full Part A deductible. Not one company's Plan G will pay 90% of it or one company will pay 110% of it. They will all pay the exact same. When you have made your decision on what Medicare supplement plan you want, you don't need to worry if one company's Plan G or Plan N pays more or less. Let's get back to the sentence that says, cost is usually the only difference between Medigap policies with the same letter sold by different insurance companies. This is accurate, but not 100% accurate in my opinion. Many untrained agents you will talk to like to say, the Medicare supplement plan you choose has the same benefits with every company. You might as well just pick the cheapest because they're all the same. It is true the monthly premium between the companies can be a lot, over $100 a month difference sometimes. But picking a company just because they are the cheapest, now that can be dangerous. While we know the benefits are the same, not all the companies are the same. When looking for the right company, you should take into account things like rate increase history, how long a company has been in the Medicare supplement market. At the time I have made this video, several Medicare supplement companies have left the market, and that can cause you rate problems down the road. If I've edited this video correctly, you should be seeing these things appear up here in the top right-hand corner called cards. They are links to other videos I have made, and in the cards should be links to videos about companies that have left the Medicare space. I think they are good explanations of what can happen if you get the wrong company. There are more differences besides just price. Some companies can offer additional benefits beyond the basic benefits. Some companies offer free gym benefits, and some offer vision and hearing insurance. Some offer over-the-counter pharmacy benefits. This is why it is very important not just to shop these plans by price. Also, why an independent agent like myself can be very valuable to you. We are able to shop all the plans from all the companies in just seconds, and all of my services are free to use. So, now we know a Medicare supplement is something we purchase from a private insurance company to pay for the gaps in Medicare. And we also know it is easy to compare plans because the benefits are standardized. I want to get a little terminology straight before we move on. Medicare supplements are sometimes called Medigap policies. They are the exact same thing, they just can be referred to with two different names. Next, I will talk about the costs that Medicare beneficiaries incur because, as we know, Medicare doesn't pay 100% of the bill. I will show our most popular Medicare supplement can pay every deductible, copay, and coinsurance Medicare doesn't pay for, except for a small $203 once per calendar year deductible. Now let me give you an example. I know this example is ridiculous, but it really illustrates how good this coverage is. Imagine in January you're diagnosed with cancer. Then in February you have a stroke. Then in March you have a heart attack, and then by April you're hit by a bus. Besides the monthly premium you pay for the plan, your out-of-pocket cost with this plan would just be a small deductible of $203 in 2021 for all of your Medicare approved claims. Now that's some good coverage. I will also show you a plan that has a lower monthly premium but has a few more out-of-pocket costs for the Medicare beneficiary. These are our two most popular plans. The first one I described is called Medicare Supplement Plan G, and the other is called Plan N. So what does a Medicare supplement, also called a Medigap policy, pay for? Here is a chart of all the Medicare supplement plans available. I also get this from the guide for choosing a Medigap policy. Medicare supplements, they're lettered A through N with a few letters missing. When you look at the chart, it can be a little overwhelming, but there are only a few options that are truly worth purchasing. Our two most popular plans are Plan G and Plan N. You may hear about Plan F, but it is no longer available for purchase for Medicare beneficiaries that have a Medicare effective date of January 1st of 2020 or later. So for most of you watching this video, that leaves Plan G and N. I want you to look at the column labeled Benefits on the left. These are the deductibles, copays, and coinsurance you would be responsible to pay if you only had original Medicare Parts A and B and didn't purchase any Medicare supplement. I am going to explain this a little out of order than the chart shows, and all dollar amounts I give are for 2021. If you are watching this in 2022 or beyond, the costs will probably be a little higher. I will start with the Part A deductible. Part A deductible is $1,484. This covers you for the first 60 days in the hospital. This 60 days is called a benefit period. This box here is for hospital stays lasting 61 to 90 days. You are responsible to pay $371 per day during this period. Also included in this box is hospital stays lasting more than 90 days. For hospital stays lasting over 90 days, you are responsible to pay $792 a day until you exhaust your lifetime reserve days. You get a total of 60 lifetime reserve days, and more on lifetime reserve days in a moment. So by looking at this chart, you can see that Plan G and N, and others by the way, but we're focusing on G and N in this video, pay 100% of the Part A deductible of $1,484, and also 100% of the Part A coinsurance and hospital costs. Those costs are the $371 per day for hospital stays lasting between 61 and 90 days, and the $792 per day for stays lasting over 90 days. Plan N and G will also give you an additional 365 days of inpatient hospital coverage if you use your 60 lifetime reserve days. Now we'll talk about the Part B deductible and Part B 20% coinsurance. You can see under Plan G and N, the Part B deductible boxes are blank. That means you, the Medicare beneficiary, are responsible to pay the deductible out of your pocket. This isn't a big deal because in 2021, the deductible is only $203. This deductible is only once per calendar year. I get asked if this deductible is on each service, and the answer is no. You only pay the first $203 of all your Part B claims per year. Next is the Medicare Part B coinsurance. This is the 20% we hear about. After the first $203 of Part B claims, Medicare will pay 80% of the Part B claim, and you, the beneficiary, are responsible to pay the remaining 20% of the Medicare negotiated amounts. But if you have a Plan G, you can see it will pay 100% of the 20% Part B coinsurance Medicare doesn't pay. Now let's look under Plan N. Plan N will also pay 100%, but it has a few asterisks. Plan N has a lower monthly premium in general as compared to Plan G. One of the reasons being is when you go for a doctor visit and you have already paid the Part B deductible, you are responsible to pay up to, now notice I said up to, a $20 copayment. This is the maximum copay. Sometimes it could be less than $20, but $20 is the max. Also, when you go to the emergency room, you are subject up to a $50 copayment, and that copayment is waived if you are admitted to the hospital as an inpatient. Having these small copayments built in helps lower the monthly premium of Plan N. Next, I'd like to look at this row, the blood first 3 pints. If you need blood, Medicare doesn't pay for the first 3 pints. Don't ask me why, I just know Medicare doesn't pay for it. But if you look under Plan G and N, these Medicare supplements will pay for the first 3 pints. You may be asking, well, what happens after the first 3 pints? Medicare will pay for additional pints, but with an 80-20 split, with the Medicare beneficiary being responsible for the 20%. So Plan G and N, they will pay 100% for the first 3 pints, and then Plans G and N will also pay 100% of the 20% coinsurance you would be responsible for under the Part B 20% coinsurance. And if you have a Plan N, because the blood isn't a doctor or emergency room visit, it isn't subject to any copays. Now we have skilled nursing facility care coinsurance. The coinsurance for the first 20 days is $0, but for days 21 through 100, the coinsurance you are responsible for is $185.50 per day. With Plan G and N, they will pay the entire coinsurance for up to 100 days. If you max out the 100 days, this is a benefit of $14,840. Okay, we're down to our last 2 on the chart. I will start with the easier one, the foreign travel emergency. Original Medicare doesn't cover service outside of the United States. But if you have a Plan G or N and you have an emergency while traveling outside of the United States, this coverage will pay a lifetime maximum of $50,000. There is a $250 deductible, and the Medicare Supplement will pay 80% of the claim, and you are responsible to pay the other 20% of the bill. The last area I will cover is excess charges. They can be a little confusing. I have made a separate video explaining them more in depth and how to look to see which providers charge excess charges. But briefly, I need to discuss what an excess charge is. But before that, there is a term you need to know. The term is Medicare assignment. When a provider accepts Medicare as payment in full, it is called Medicare assignment. When a provider does not accept Medicare as payment in full or doesn't accept Medicare assignment, which is unusual, and by the way, over 90% of all providers accept Medicare assignment. But if a provider doesn't accept Medicare assignment, the provider has the option to charge you an extra 15% above what Medicare pays them. If Medicare pays them $1,000 for a service, for example, and the provider has decided not to take Medicare assignment, they may charge you, the Medicare beneficiary, an additional 15% or $150 in this example. You can see under Plan G that it will pay 100% of these excess charges. However, with Plan N, you, the Medicare beneficiary, is responsible to pay the excess charges. This is another reason why Plan N generally has a less expensive premium than Plan G. Please watch my video on excess charges. It outlines more about excess charges and Medicare assignment, along with also how to use Medicare's website to look up all providers that accept Medicare and those that accept Medicare assignment. Again, over 90% of all providers accept Medicare assignment and don't charge an excess charge. You may be wondering, when is the best time to buy a Medicare supplement? And I get this directly from Medicare's website. It states, buy a policy when you are first eligible. The best time to buy a Medigap policy is during your 6-month Medigap open enrollment period. You generally will get better prices and more choices among policies. During that time, you can buy any Medigap policy sold in your state, even if you have health problems. This period automatically starts the month you're 65 and enrolled in Medicare Part B medical insurance, and it can't be changed or repeated After this enrollment period, you may not be able to buy a Medigap policy. If you're able to buy one, it may cost more due to past or present health problems. During open enrollment, Medigap insurance companies are generally allowed to use medical underwriting to decide whether to accept your application and how much to charge you for the Medigap policy. However, even if you have health problems during your Medigap open enrollment period, you can buy any policy the company sells for the same price as people with good health. Next, I'd like to read the section for being outside of your open enrollment. It states, if you apply for Medigap coverage after your open enrollment period, there's no guarantee that an insurance company will sell you a Medigap policy if you don't meet the medical underwriting requirements. Before I end this video, I want you to understand a very common misconception about open enrollments and Medicare supplements. I get many calls during the Medicare annual enrollment period that lasts from October 15th to December 7th. It is critical to understand that this time has absolutely nothing to do with Medicare supplements. Many people have the impression, and I understand why, because the ads that are run during this time are misleading, especially ads with celebrities, in my opinion. But the impression during this time is that you can buy for the first time a Medicare supplement and be guaranteed to be accepted at the best possible price. They also believe that during this time that they can switch to a new company without having to answer medical underwriting questions. The only time you can get a Medicare supplement for the first time without answering any medical underwriting questions is during the first 6 months your Part B is effective. This time from October 15th to December 7th only applies to Part C Medicare Advantage and Part D prescription drug coverage. That's all I have for today's video. I hope it wasn't too long. I do my best to keep these as short as possible, but there is a lot of information to get you. Let's quickly recap. A Medicare supplement is offered by a private insurance company for a monthly premium and helps pay the gap original Medicare doesn't pay for. Medicare supplements and Medigap policies are the same. They are interchangeable terms. The two most popular plans we provide are Plan G and N. Plan G generally has a higher premium than Plan N. And Plan G will pay every deductible, copay, and coinsurance Medicare doesn't pay except for the small Part B deductibles. Plan G generally has a lower monthly premium but has more out-of-pocket costs you are responsible for. Where Plan N differs from Plan G is when you go for a doctor visit, there is a maximum $20 copay, and when you go to the emergency room, there is a maximum $50 copay. And Plan N doesn't cover excess charges. The best time to buy a Medicare supplement is during your 6-month open enrollment that starts during your birthday month. By the way, you can actually purchase your Medicare supplement up to 6 months prior to your 65th birthday month. It doesn't go into effect until your Part B start date, but for those that like to get this done early, you can get it out of the way up to 6 months before you turn 65. Please subscribe to my channel so you'll be notified of more important videos that I make. Be on the lookout for another video I have made on how to choose the best Medicare supplement company. Once you have chosen the Medicare supplement plan that is best for you, then you need to choose the right Medicare supplement company. And like I mentioned, they are not all the same. Again, I'm Chris Duncan. If you have a question about this or anything else Medicare related, I'm here to help. I help with Medicare supplements, Medicare Advantage, Part D prescription plans, dental, vision, hearing plans, final expense life insurance, also called burial insurance, protecting retirement savings, and more. If you'd like my help, it's easy to contact me, 800-910-3382, and I look forward to seeing you in our next video.